This video continues Chapter 9, Airway Management, and we're going to look at how we can use oxygen with a patient. So we'll talk about safety with oxygen cylinders, when we should use oxygen with a particular patient, and then the steps we go through to put an oxygen cylinder into service. So oxygen makes up about 21% of our atmosphere. The majority of the atmosphere is nitrogen, and 1% is things like argon and CO2. Now, if we don't have adequate perfusion, meaning oxygen getting to the tissues, tissue damage or death can occur. At a systemic level, cells working together as organs, we can see organ failure, shock, and death at the extreme end of lack of oxygen getting to tissues. So we will give supplemental oxygen. Now, in some areas, you may not be permitted to administer oxygen, but it's part of our standard of training for OEC. In this case, make sure that you're aware of your local protocols, and this will come from your patrol's medical advisor. So the oxygen we administer to patients is 100% pure medical oxygen. So unlike our atmosphere, which is 21%, we've got 5 times the oxygen partial pressure available to help perfusion to the tissues. Now, medical oxygen is actually labeled USP. It's pharmaceutical grade. It's stored as a compressed gas, and we see, for recognition, they're either solid green or have that green stripe on the top near the valve. So to administer oxygen, you don't just need the cylinder, but you need a regulator and a flow meter to take that high pressure stored in the cylinder down to a manageable pressure for delivery. The flow meter basically works on a volume basis after the pressure has been reduced, and then we need some sort of a delivery device to the patient, and that will be a nasal cannula or a non-rebreather mask. So oxygen is compressed to 2,000 pounds per square inch. And the cylinders are going to be of varying size. Typically, they're made of aluminum. It's a little bit lighter weight. And we see the D cylinder that most patrols will have in a trauma pack can provide about 350 liters of oxygen when it's delivered to atmospheric pressure. These cylinders are pretty small. There may be only about 4 liters in terms of total volume, but at 2,000 psi, that's what we're trading. We're trading high pressure, low volume for high volume and lower pressure, atmospheric pressure, when we deliver it to the patient. At about 4 liters per minute, which we would use with a nasal cannula, that D cylinder in a trauma pack goes about 70 minutes. At 15 liters per minute with a non-rebreather mask, you've only got about 20 minutes. So it's a nice timeline when you're on scene working with an injured patient. That 20-minute timeline gives you kind of a mark for the progress you should make in your treatment. Now we see at the top of the cylinder that valve is going to allow you to control the flow of oxygen from the cylinder. Don't confuse that with the valve that simply opens the cylinder. What we're describing is essentially the pressure regulator or the flow meter. Remember, the cylinder is at 2,000 psi. The regulator dials it down to about 50 psi, and then the flow meter, which is also part of that single unit, is attached and allows us to deliver oxygen to the patient anywhere between 2 and 15 liters per minute. Now, whether we deliver it at 2 liters per minute or 15 liters per minute depends on the patient's condition and the device that we use. Now, before we place the regulator onto a cylinder, just be aware that there's a gasket inside that regulator that has to be in place. If that gasket is missing, you'll know. You'll have a lot of hissing, a lot of loss of gas. You just simply need to turn off the cylinder, remove the regulator, and replace the gasket. Many patrols will have an extra gasket tied to the oxygen wrench. Now, at the far end of the delivery, we're going to deliver to the patient. Nasal cannula is something that you see perhaps on a hospital TV show. It's that little device with two prongs that are just small tubes. They fit into a patient's nostril. The delivery is pretty low. It's intended just to supplement their breathing. And so we go from that 21% oxygen in room air up to between 35 and 50%. A face mask or a non-rebreather face mask can deliver up to 90% oxygen. We will typically have non-rebreathers in trauma packs on the hill. Now, oxygen safety comes down to two things. First of all, understand that oxygen, it's not flammable in and of itself, but it supports combustion. So if you are near some sort of a fuel, we need to be careful with the administration of oxygen. That's why we shouldn't allow a patient or bystanders to be smoking, because that would be the ignition for any sort of combustible material that's nearby. The other thing to consider is compressed cylinder safety. So that cylinder should be laid on its side when you're working a scene, or inside the padded case that they typically come in inside a trauma pack. In a first aid room or a clinic, they're typically secured to a wall with chain or some other sort of a structure, perhaps a case. Let's focus on oxygen therapy, and the indications for patients who may need oxygen is anyone who is short of breath. If we're dealing with a cardiac or respiratory emergency, including a possible heart attack where we see a patient with chest pain. If we have some sort of possible stroke or transient ischemic attack, something going on with a possible brain bleed or blockage to the brain. If we have significant blood loss and we're concerned about hypovolemic shock or a head injury. Now, to administer supplemental oxygen, we'll choose a device depending on that. But what happens is we're basically, again, going to boost oxygen from the atmosphere at 21% to a much, much higher concentration that allows for better perfusion to the body's tissues. The steps are to, first of all, go ahead and crack the cylinder at the top of the oxygen. That's going to just by cracking that valve a little bit, it'll blow any dust that may have accumulated there. Then you can secure the regulator in place by lining up the two pins on the indexing system. The regulator will only go on one way. As you do that, make sure the gasket is in place. Tighten the regulator securing screw onto the top of the valve, and then you're ready to open the oxygen cylinder. Oxygen will only flow as far as then the closed regulator and flow meter, and after you get the device in place, you're able to deliver oxygen to the patient. Now be aware, a full cylinder is at 2000 psi. If the cylinder you're working with on scene is less than 500 psi, it's going to be ineffective and not provide you enough time to finish treatment and transport the patient. Replace it with a full one. In summary, working with oxygen is an important way to support a patient who may be injured or ill. To do so, we have to consider oxygen safety. We have to know how to properly put that cylinder into service and which device to use to deliver oxygen to the patient effectively.